before the patient undergoes this first trimester screening, we do pre-test counseling. We explain to patient in simple words. What is aneuploidy? Abnormality in the chromosomal makeup, may it be in the structure or may it be in the number. What is trisomy? Presence of an extra chromosome at a particular pair of number of chromosomes. For example, trisomy 21 means instead of normal 2 chromosomes present at chromosome number 21, there will be one extra. That means there will be 3 chromosomes at number 21. And this is what causes the problems. What if your fetus has increased NT value or the nasal bone is not visualized? It means there is greater risk of trisomy, aneuploidy, structural defect, and cardiac defect in the fetus. So, we recommend definitive diagnostic invasive test which is indicated to when there is NT is more than 3 millimeters. What if your fetus is having NT below 3 millimeters, that is normal value? Now, NT scan has the detection rate of trisomy 21 to the tune of 80%. So to increase the detection rate in such cases, we recommend a combined test, that is add double marker test. So the detection rate goes up to 90%. And further to increase the detection rate or sensitivity, we add few more sonography parameters like nasal bone, ductus venosus, tricuspid regurgitation. Altogether, the detection rate increases to 95%. What if the screening shows there is increased risk of preeclampsia or FGR? Your healthcare provider or your doctor may prescribe you certain medicines like aspirin for the prevention of this preeclampsia or FGR or for delaying the onset of preeclampsia or FGR. How is the first assessment of the length of cervix useful? It acts as a baseline for comparison for the cervical length in future sonography scan and take the decision accordingly. What if you are detected to have structural anomaly in the fetus? 10 out of 100 structural anomalies can be detected in this scan, and your healthcare provider will help you and to decide about the prognosis and help you in the decision making. Now, before the patient undergoes first trimester screening, we assign what is called as pre-test risk. We subject the data, we put the data into the software. The example, FMF, fetal medicine founders software, from the history and from examination. From the history, mother's age at the time of delivery, how many children she has, that is parity, previous number of miscarriages, aneuploidy in the previous pregnancy and which type of aneuploidy, history of smoking or tobacco consumption, maternal diabetes mellitus, maternal chronic hypertension, SLE, Epla syndrome, whether it is natural or IVF conception, and did the patient's mother have preeclampsia when she was pregnant. From examination, height in centimeters and weight in kilograms are added to the data in the software. Having put this data in the software gives us the pre-test aneuploidy risk calculated on patient-specific basis. That means it will give the patient-specific risk to us. NIPS also is a screening test. It is much costlier, but it avoids unnecessary invasive tests in quite a few number of cases. What is the result? The result may be low risk, which is reassuring. You may not go for any further testing. If the result is high risk, then again one has to undergo diagnostic invasive test in the form of CVS or amniocentesis, because there is a very low but definite possibility of a false positive test. After invasive test, the patient may have spotting or bleeding PV for short duration, and the procedure specific risk of miscarriage is 1 in 300. What is the detection rate of NIPS? For trisomy 21, it is as high as 99%. For trisomy 18, it is 93 to 98%. And for trisomy 13, it is 99%. All these has a false positive rate of 0.04%.